Good morning and welcome to today's podcast. My name is Megan Kim and I'm the Executive Director for COSE and a Senior Vice President at the Greater Cleveland Partnership. The focus of today's discussion is on COVID-19 vaccines. As Ohio receives and begins to administer these first waves of vaccines to help combat the coronavirus pandemic, we've received a lot of questions from many of our region's businesses that are looking for facts and information to help guide their future decision making and to understand how it will impact their operations and their workforce, especially our small businesses. So we're very fortunate that we're joined today by three experts who are going to help us break all of this down and help all of you understand what's next. Before I introduce our panel, I just want to provide an overview of our webinar. Each of our panelists will share specific information based on their areas of expertise, and then we'll open it up to all of you to ask questions. I ask that you use the questions section in the control panel. You can just type in your question. I'll be monitoring it throughout the presentations, and then I'll relay your questions to our presenters. We are recording this as well, so you can watch it again afterwards, or if you have other colleagues or other businesses who are interested in the content, please do pass it on to them. So let's get started. I want to introduce our panel today. We have Dr. Brooke Watts, who's the Senior Vice President and Chief Medical Officer, Community and Public Health at Metro Health. We have Richard Sarkar, partner at Dinsmore and Scholl LLP. And we have Martha Lanning, who's the Director of Health and Welfare Plans at the Sherwin-Williams Company. Thank you all for being with us this morning. I'm going to ask Dr. Watts to start us off and talk about the rollout of the vaccines and what she's seeing. I literally know this has been her life since last March. She knows everything that you need to know, so I'm going to kick it over to you, Dr. Watts, to get us started.
Well, thank you so much, Megan, and I think it does feel like it has been my life. But I am so pleased that we could be here on this webinar today talking about vaccine. And I'm not sure even 6 months ago that many of us thought that that was going to be possible. So there is a light at the end of the tunnel. You know, I think we see an end to this pandemic, and the end of the beginning starts with this vaccine. Here in Cleveland, we've been rolling out vaccines since roughly the middle to end of December when we got our first doses into the community. I think most folks are aware those were earmarked for our 1A workers, which are primarily healthcare workers who work in our hospitals and other high-risk environments like nursing homes. We, as the health systems in Cuyahoga County, have been getting supply directed for these workers and distributing it ourselves. So our first experience with vaccine distribution was in our own workers, and I can tell you that we have learned a lot. This is not your everyday vaccine. This is not like flu vaccine. This is not like some of the other vaccines that we think of bringing directly into the workplace. It's not very mobile, and it requires really some extensive and careful handling. A couple different reasons for that. One is it comes in multi-dose vials, and those vials, depending on the type of the vaccine, need very special handling with refrigeration and freezers. So the challenge we have, and just to give you an example, is we have two vaccines right now. So we have the Pfizer, comes in a vial that has 5, 6, or 7 doses in it, depending on how careful you are and what kind of needle you use. And we have the Moderna vials that have at least 10 doses in them. And once you've cracked into that vial, you've got to get that out in a certain period of time. So you can start to see why it's really difficult to do this in smaller settings, like a small business or even in a primary care office, because you need to make sure that not a single dose is wasted. So right now, we really do quite a bit of logistics to make sure that every dose gets in an arm. The second challenge with the logistics is that each of these 2 vaccines that are approved here in the U.S. right now require 2 doses. The spacing on those doses is a little different depending on which vaccine. So we also do quite a bit of tracking to make sure the right person is getting the right dose of the second vaccine at the right time. We do find, and we'd be happy to discuss with the group, that there is quite a bit of hesitancy around populations who are concerned about these vaccines, either because they think they were rushed, they're concerned about the technology that was used, which is a newer technology for vaccines, and just really sort of trying to understand what it means to take in the context of someone who's had COVID or maybe had mild COVID and now is wondering about taking the vaccine. So a lot of different kinds of conversations that need to be had in that space as well. So again, I'm very excited. I'm very enthusiastic about these vaccines. I've had both doses of my Moderna vaccine myself. but really learning a lot about some logistical challenges as we try to get this out in the community. I think I'll stop there.
Dr. Watts, when we were talking earlier just about the rollout and some of the challenges with how many vaccines we have from a distribution perspective, I don't know if you can talk a little bit about that. And then also the other thing that you had mentioned was there were a lot of questions around, do I have to get 2 of the same? So if someone already got Moderna, can they get Pfizer? What are you recommending from a medical perspective?
Sure. So the first point, and probably one that we can't make loudly enough at this point, is the supply chain problem. We do not have enough vaccine in this community. There is not enough vaccine for everybody who's deserving. And this is extremely frustrating for those of us who, again, would like our lives back. And we see that this is the end of the beginning of the pandemic, but we don't have enough vaccine. And this, it's not something that in my mind, that even the state controls at this point. This really is a production problem. Each Tuesday, the federal government notifies the state notifies us. We try to figure out how much vaccine we're going to get this week. We have to plan very, very rapidly. Sometimes we have less than 24 hours notice that we're getting a shipment of vaccine that needs to get out very quickly. So for this reason, we've put these categories in place, right, that are really limited on who is eligible at even given time. And the reason those categories are put in place is because 75% of the deaths have been on our older folks, our seniors, right? So if you have a limited resource and you want to really try to save lives and prevent morbidity, which is hospitalizations, right? We have people have had incredibly long hospitalizations with this. You put the vaccine in those highest risk groups. So that's been the nursing homes, which you've heard a bit about, and then it's our seniors. And so what that means is that there's not a lot of vaccine left for anybody else. And we really haven't had the volume to be able to move out of that highest risk group. The other thing that we're seeing is that the whole world is competing for this vaccine. So to your point, Megan, we were all a little bit surprised to see that the CDC released some new guidance over the last couple of weeks that said, you should try your darndest and, to get 2 doses of the same vaccine, right? So it should be 2 doses of the Moderna or 2 doses of the Pfizer. But if you can't, they gave us a window of about 6 weeks after the first dose, which is a bit longer than we had originally sort of been instructed, really, but it's okay. So they say, okay, you got about 6 weeks after the first dose. You should try your darndest to get the same dose the second. But if you can't, because of supply chain, you can actually get a second dose of the other vaccine. This is not something that I can think of in terms of a precedent of how we've treated vaccines, but I think it speaks to this very first point, which is that we have a supply chain problem. And I think that unfortunately is going to continue for the near future.
Thank you, that's helpful. And I know there'll likely be some questions rolling in a little bit later about the vaccine. So I'm going to move to Martha now. Martha Lanning from the Sherwin-Williams Company. Thank you, Martha. Good to see you. Former COSE employee, so we're glad to see you back with us again.
Glad to be back.
Martha, I know that you guys have been obviously talking about your plan at Sherwin-Williams and how important it is to educate employees. So, to connect what our large corporate community is doing with small businesses and middle market companies who are looking to set their plan, we'd love to learn from you and how you guys have really been looking at this moving forward.
Sure, thanks for inviting me this morning. Glad to be back in the old stomping grounds, even virtually. But to support what Dr. Watts indicated, it's really a challenging and an opportunity for our company and for all companies. We are affected by the supply chain problems. So, typically Sherwin-Williams and other, mid to larger companies would contract with a provider to come in to do on-site vaccinations like we do for our annual influenza vaccination program. But because of the supply chain problems that we've seen, as Dr. Watts indicated, we really are unable to do that. And I have some slides that might illustrate some of the points that Dr. Watts made. Let me know if I'm showing my screen. All right. Let's see.
You're up.
Great. You can see the slides. Great. You can see that the distribution for, let me just close this. The distribution in the US is the federal government to the states for the most part. And we've heard yesterday that the president and the Biden administration will start next week in directing vaccine directly to a number of pharmacy chains like CVS Health and Walgreens and others. So that's really good news from a vaccine standpoint and from an availability standpoint. But for the most part, the federal government owns the vaccine and is distributing to the states, and the states determine exactly how they're going to distribute it. And to Dr. Watt's earlier point, you know, we have a very limited supply, so it is really focused on the most at-risk populations, those being older people, first responders, healthcare workers. So you can see that we're in kind of phase 1A for the most part, moving into phase 1B. So phase 1A is healthcare workers, residents at long-term care facilities and nursing homes, folks that have developmental disabilities, EMS responders. And in phase 1B, it's moving right now into, based on availability, Ohioans who are age 65 and older. So there's a whole cadence of availability based on your age. But again, you know, it's all key and based on availability. Importantly, I think employees of K through 12 schools, so teachers and other folks that work in schools are really focused in phase 1B as well, to get as many schools back from hybrid into the actual classroom. So you can see that there is a cadence that the state of Ohio has provided in terms of age and in terms of selected population. So it's going to be a while before the general public is going to have availability. And I'm on our company task force for the vaccine. And what we've talked about is trying to identify providers that might be able eventually to come on site to our population centers like in Cleveland and our plants throughout the country. But once the vaccine is widely available, you're going to be able to get it from your healthcare provider, from pharmacies, which we're already starting to see with the Biden administration announcement yesterday, and to Dr. Watt's point, community vaccination sites like the Cuyahoga County Fairgrounds. And so from all information available, based on the number of vaccines that are going to be available, we're probably looking at spring before there's a supply that's going to be widely available for small businesses and mid-sized businesses to encourage their employees to get the vaccination. Ohio has a great resource at vaccine.coronavirus.ohio.gov, whereby you can actually enter your county or your zip code and identify places that are distributing the vaccines. So you can see here we've focused in on Cuyahoga County, and you can actually zero in, and they've also put the phone number and the website onto the vaccine administration location finder. So this is a great tool to let your employees know about. I think from our perspective, our focus right now, and I would encourage most employers to focus on education of your workforce. There are some populations that are quite hesitant about the vaccine, and there are a number of resources available to you to provide to your employees, starting with the CDC, and I'll talk about that in just a moment. But when you look at vaccine coverage, some folks might be hesitant because of a cost impact. There will be no cost to your employees for the cost of the vaccine. So the federal government has paid for the ingredient costs in the vaccine through the CARES Act, and health plans have to cover the vaccine with no member cost sharing. The health plan will cover the cost to administer the vaccine, so that administration, the actual drawing it and putting it into an arm. If you go to an office visit to see your physician, health plans can't charge you for that office visit. So I think that's an important thing to check on with your carrier, your insurance carrier, if you offer a health plan to your employees, to verify exactly what the process is at this time to cover the vaccine, where employees can go, and again, it's really going to be at no cost to them. The other thing that I mentioned that I think is really important for employers, regardless of size, to do is to educate your workforce. There are a number of readily available toolkits that you can access that provides information that you can, run off a copy and post in your work site, or you can distribute via email to your employees. This is an example of what's on the Ohio Department of Health at coronavirus.ohio.gov on facts about the vaccine to address some of that vaccine hesitancy that Dr. Watts spoke of. And there are also toolkits available at the CDC. So you can see here some of the posters and other information that you can access with no charge and just download to help employees have the vaccine kind of front of mind and to help them identify places to obtain the vaccine when it's more readily available. So you can see the CDC, the state of Ohio, perhaps your national industry associations, if you're a manufacturer, for example, the National Association of Manufacturers or the Ohio Association of Manufacturers. Certainly GCP and COSE, I'm sure, would provide assistance in that, as well as your health insurance provider. So the COSE program members that are in the Medical Mutual of Ohio program, for example. And of course, local hospital systems like Metro and UH and the Cleveland Clinic. So lots of information, easy to get, and really, I think that's going to be the key focus for employers, is to help get the word out on the efficacy of the shot, the safety of the shot, and where employees can get a shot.
Thanks, Martha. And I don't know if you guys have a plan in place, but how is Sherwin-Williams looking at kind of getting everyone back? Have you started to think long-term about that as you're timing the, the vaccine rollout and how you're getting folks back into the offices?
Great question, Megan. Our stores and our production facilities, so our plants and our distribution service centers and all of our 4,000 plus stores have remained open throughout this process, throughout this pandemic. So our stores were doing curbside service early on, and then switched to being able to take all of the safety measures to allow customers into our stores. We provide support for paint contractors, small businesses that are paint contractors, and we've continued to provide excellent customer service and supply to those folks. Our main office here in Cleveland, in downtown Cleveland, our headquarters, we do have a plan for return to office, and looking at what's going on with the variant, and making sure that when we do go back to the office for our full contingent of headquarters employees, that we do so in a very safe and socially distanced methodology. So we do have some folks that are in the office, very small number of people compared to our full headquarters employees. But once we do determine how to go back to the office safely, it'll probably be done on a rotational basis. We've been very lucky to have our headquarters employees work remotely, and really kind of turned on a dime last March to be able to do that through our IT folks and all of our teams. So it's worked out well, but we really are a collaborative type of working environment. So we're looking forward to going back to the office in a safe and effective manner.
Great, thank you. And you said something that I want to actually touch on after Richard's comment, which is the world after the vaccines, because we were all talking about that a little bit on our prep call too. And I think it's interesting because, you know, I think people are wondering, are we all just going to get the vaccines and then the world goes back to normal? So I want to talk about that sort of in our next phase. But thank you, Martha. So Richard, it's really important for you to be here today because we are getting a lot of questions from businesses who are asking, you know, should I be incentivizing employees to get the vaccine? What if they don't want to get the vaccine? How does that impact their job? And so having you here from a legal perspective to talk about some of the counsel that you're providing to the businesses that you work with is very valuable for us. So I'm going to ask you to make some comments on what you are seeing and how you are kind of coaching some of the businesses that you work with and also what your business is doing.
Sure. Well, let me start with the big questions people ask, which is, you know, can I require my employees or from employees, can I be required to get the vaccine? The short answer to that is yes, your employer can require you to get vaccinated, but we'll get to, first of all, whether that's actually something an employer should do. But even within that requirement, there are two exceptions. The first exception is under the ADA. If someone has, for example, a medical condition that won't allow them to get the vaccine, an employer needs to give them a reasonable accommodation for that purpose. So probably maintaining, you know, if you had plexiglass separators or social distancing rules, mask wear, things like that, you need to make a reasonable accommodation for employees that under the ADA are protected because they have a condition that won't allow them to get the vaccine. The second exception is a religious exception. If someone's religion, you know, is prevents them from getting the vaccine, and this has to be a sincerely held religious belief. It's separate from whether a person thinks that they should be getting the vaccine, and it's more of a religious sort of you know, edict that says, listen, you can't get certain types of medical care, you can't get certain types of vaccines. And again, an employer is required to make that exception unless it would cause them an undue hardship. So, you know, that obviously is a sliding test, and it really depends on you know, the employer's resources, what they have budgeted for this sort of stuff. Also, whether it would, you know, significantly disrupt the rest of their work environment. Now, that being said, I don't know that anyone so far has come out and said we absolutely are going to be requiring all of our employees to get vaccinated. You know, the fact, this is one of those things, the fact that you could do something does not necessarily mean that you should do something. And in many instances, what we're seeing is that clients are actually incentivizing employees to get the vaccination. They're educating them. They're explaining why vaccination is a good idea. In some cases, I've heard of employers providing, you know, a paid day off for getting the vaccine, and then paid days off for, you know, the second dose of the vaccine. Understanding that the second dose of the vaccine is the one that may cause certain side effects. And my understanding is because Dr. Watts told me that yesterday. But in that instance, you may consider giving them 2 days off or 3 days off after that second dose, just to urge people to get the vaccine. And so the employees know that they're not going to be penalized because they're doing something that is best for the work environment. I think there will be an exception if you're in a union shop. That may be something that's going to be the subject of collective bargaining, things of that nature. But again, you know, I think that sort of collective bargaining process is going to educate both sides a great deal about why things should be required, why things should be done, why things shouldn't be done. But yeah, the short answer is you could require your employees to do it, but I've yet to see anyone that actually said that they are. And in fact, I think the Ohio State medical system has already said that they're not going to require their employees to get the vaccine, even those that are on the front line. they are just going to encourage them to do so, and that's really the plan that a lot of places are following.
Yeah, and I know that's and that was one of the questions actually in the chat, was that people have heard about incentivizing, giving gift cards. So that is something that you're seeing businesses are doing to kind of encourage folks.
Yeah, I mean, I think it's just like, obviously, I don't like comparing COVID to the flu, but in the vaccination aspect of it, there are lots of employers that make it easier for you to get a flu shot. And the reason, because obviously that would disrupt, if everyone, the fewer people that would be exposed to and then pass the flu, the better off for a for any sort of shop. Even, at our place at Dinsmore, we encourage people to get the flu vaccine, but no one is in my office with a needle saying it's time for your flu vaccine. That said, though, we did have a morning, but I think that where we had people in our office that were offering the flu vaccine, and that actually might have been done by our landlord as opposed to just our office. But lots of places have days where they help make it easier for you to get the flu shot. When we get to the point that the vaccine is more available, we may have similar things at that point. But again, you don't really see anyone saying, "Yeah, you have to get this vaccination." As far as incentivizing, the incentive may go in many different directions, and what's best for a company is going to be determined by that company. And an employer has a better idea of, is it better for me to offer days off as opposed to a monetary incentive. And I don't think that there's anyone that's going to be trying to gaming the system and trying to get a gift card and a day off or things of that nature. But yeah, really, you're seeing a system where many people are going to be incentivized to get the vaccine. Now, employers may spend more time, like I said, educating their employees, asking them specific questions about how they're feeling, things of that nature, just because they want to monitor what's going on in their workspace. And you may still see, even post-vaccine, some of the precautions that are going on right now. Like I said before, plexiglass, mask rules. In our office, we make sure that we don't have, we limit the number of people in particular conference rooms, things of that nature. And I think lots of places are doing that. And I think that that's going to continue post-vaccine for a little while, unless we get some sort of guidance from the CDC or the EEOC, the Equal Employment Opportunity Commission, which will tell us, that helps kind of direct companies and lawyers, for that matter, how they should be counseling their businesses and their clients. Until we see something from them that mandates something, I don't think employers are going to mandate anything.
Mm-hmm.
And that honestly,
and I like it when Dr. Lee, I was going to say, I like it that Dr. Watts is nodding her head, because that means that I said it right.
Right, Rich. I couldn't agree more with your points. I think that the challenge for these vaccines, they are under an emergency use authorization, as we've talked briefly about. It's technology that's been around for a while. It's not that the technology itself was developed, in the last year, but really this technology for use in this type of vaccine for wide distribution is new. And, we think they're very safe. I feel like they're very safe. I think this is, again, part of how we end the pandemic. But it is, there are reasonable people who have reasonable questions. And I really do believe that we all have the right to feel comfortable when we get something like a vaccine. So I really like the framing of saying we're going to do remove barriers. So that means making it accessible in whatever way you can and educating. But I think something that feels like coercion at this point doesn't feel at least right to me. And I think that's where most of the professional societies have come down as well. The challenge is with something like flu vaccine has been around for a long time. We have long-term data on it. I can, backwards and forwards, we know that flu vaccine, if I've gotten it so that I can't give it to my cancer patients or whoever I'm taking care of, that saves, it helps me, but it also helps others. It's really clear what the benefit of the vaccine is. With the COVID vaccine so far, we know that they prevent severe disease in the person who gets them, right? So we know they're very, very good at preventing severe disease in the person who gets them. We think that they help reduce your ability to transmit it, but we don't know that yet. So there's still pieces that we're evolving and learning, and I think that's going to be part of the framing. But I'm very curious to have you, Bridget, comment on this fact that, you know, some folks are going to get vaccinated and others are not. And so how does a business deal with the, you know, sort of having a mixed bag in the environment and trying to get people back to normal? Do you require, you know, different things of different people, or do you have to disclose your vaccination status to your employer?
You know, well, this is again one of those things employer can. It's one of those things employer could make everyone reveal it, but again, I don't think employers should make everyone reveal it. I actually think that when you have a mixed environment, and you know, considering the ADA and other exceptions to the rule, in larger groups, you are going to have a mixed environment. There's no getting around it. And I think that the best way to deal with those things is just to maintain the distancing, maintain the work accommodations. I don't think, you know, I think that, you know, I think an example is what Australia is doing. Australia right now, from what I read, has very few COVID cases still going on, but they have stopped a lot of their, you know, mask wearing, a lot of their social distancing. I am aware of for the Australian Open, they're going to have people at the event, but still they're still trying to maintain social distancing and these best habits that are getting us through and helping lower the numbers now. I think that that's what we're going to have to do. I mean, you know, the vaccination, in my view, is not going to end this pandemic. The pandemic is going to be, or at least what we call for employment purposes, the pandemic, really going to be when we see almost no cases or very few cases going on. And until then, I think that employers would be best advised to maintain the distancing rules, maintain these protocols that they have in place until the CDC or the EOC kind of gives them directives otherwise. I mean, in the face of this pandemic, when the CDC declared COVID a direct threat, and that actually was the trigger mechanism for employers to be able to do a lot of things, I think that we'd probably wait until the CDC or the EOC make assessment to the, you know, that it says, okay, the threat has passed. I'm 1000% sure that they'll never say the threat is gone, but they'll say, you know, the imminent threat has passed. And at that point, you know, we can think about getting back to normal. But I really think my belief is that until the instances of COVID are drastically reduced, I think that employers are best served to maintain the protocols and things that they have in place now.
That, from a clinical perspective, that feels exactly right. I mean, that we don't have enough, you know, to your point, that we don't have enough evidence that the vaccines, you know, are alone. It's not alone. It's yes, and it's all the other layers on top of this. So I really like the framing that it's, you know, doing as much of what we're already doing that we can. Add the vaccine as another layer, and that really helps us get to the end as quickly as we can.
Yeah, like I said, I love the phrase for many of my clients. I often use the phrase, you know, could versus should, and it's, you know, I learned it from Jurassic Park, where they talked about, you know, they were so excited about the fact that they could create dinosaurs. No one thought about whether they should recreate dinosaurs. I put this into that category. You know, just because you have the power to do something, or the ability to do something, you need to kind of step back and realize, should you do something? And in making that assessment, you know, look around and see what other employers are doing. You know, to me, it's telling when medical systems are not requiring their employees to get vaccinated, that maybe that's not the best course to take. Maybe we should talk to them about, you know, incentives and education and things of that nature. I don't know. I'd speak to what other larger employers are going to do right now. I think lots of them are trying to figure out their plan. and then they'll slowly filter it out to their employees. And again, the union aspect of it makes, that creates a separate subdivision of folks that are covered under a different set of rules. But I'd be interested, I don't know, like I said, I don't know of anybody that has rolled out and said, yeah, we're absolutely requiring that everyone has to get a vaccination.
Yeah. No, you're exactly right, Richik. We're, I think all larger employers are gathering information, providing education to employees, but because of the supply chain issues right now, really none of our employees are able to get the shot, or even are in the state of Ohio in a prioritized population to get the shots. So our focus is really focusing on education, that the vaccine is certainly one opportunity for fighting the pandemic and fighting COVID-19, but absolutely masking, social distancing, a rotational return to work for some of our office locations, making sure that we're maintaining social distancing in our stores and in our plants. That is what's keeping, COVID-19 under control and will in the foreseeable future.
Yeah, I know that most employers are paying attention to the CDC and EEOC guidelines to kind of take their cue as to what actions they should take and what stage they should take directions. And I think that those websites and that guidance is not hard to find. In fact, most most places, I suspect, make it easy to get there. A lot of trade associations have their own page devoted to these resources. Our state has a lot of specific guidance as well. They're easy places to kind of get an idea of what's supposed to be required and find that information. And I think that that's the most important thing that an employer does is let's go check and see what our local organizations are saying. A lot of this, kind of like the way the vaccine has been distributed, a lot of the guidance is being distributed along that same chart. The federal government come out with certain things, and that filters down to the state government. And here in the county, that may get down to the county or the city health officers with regards to their guidance on what they're expecting. And a lot of, let's face it, the vaccine is not going to stop the city of Cleveland's, mask edict in certain buildings. And there's lots of things that, even though we have these, the vaccination available, there's still other laws and other regulations that have been implemented for this that aren't going to go away overnight. So employers need to be cognizant of those things as well.
And really, one thing that I think employers should be thinking about right now, because the supply isn't out there, and to your point, most regular everyday employees simply aren't going to qualify for at least another month or two. This is the time to be educating, because I will tell you that vaccine acceptance, so the folks that are getting vaccine acceptance, tracks very heavily with educational level. And what we're seeing from around the state and the country is that folks like physicians, and unfortunately most of the data we have right now is within healthcare, because this is really the largest group that's been vaccinated, is extremely high. Not 100%, but it's extremely high. And as you track down healthcare workers to lower educational levels, vaccine acceptance drops very dramatically. And I think this speaks to health literacy. It speaks to real questions that folks have that are answerable, but not answerable from social media. So this is the time to get out the real information, how vaccines work. What about this vaccine? And again, I want to really focus in on this thing that somehow it was developed too fast. I think once you start to educate yourself, you realize that this is technology that's been in development for a very long time. And so I think, this is that moment when you don't have the vaccine, so that when you do have the vaccine, that you're not spending time trying to figure out how to get people to take it. So now is the time to help people get educated, answer those questions. And especially, as I should probably mention, there's a third vaccine on the horizon, which some folks may have heard about, Johnson & Johnson, which we're feeling optimistic about. It is a different vaccine. It is not the same as the Moderna and Pfizer, both in the technology that it uses. It's also one dose. It requires different handling. and it seems to be very good at preventing severe cases, but the efficacy that's being reported is lower than the other two. And that's going to cause a lot of different kinds of questions and concerns, right? Because is one better? You know, which one should I get? I'm already getting this from patients. It's like, I had someone walk up yesterday in our vaccine clinic and said, is this the good one? And I thought, I don't know which one is the good one. And actually his framing was the good one was the one that required the deep freeze, which I had not heard, but I know is out there. And then within that, I think there are also, it might be worth just touching on the fact that we are hearing a lot about specifically the Johnson & Johnson and the cell lines that were used to develop that, which go back for a very long time, but are based on fetal cells. And that has caused some concerns for others. And there's been a lot of sort of conversations, especially on social media and from patients about those things. But those are all things that employers could address proactively that would help them be positioned when they do have access to vaccine, really help get it out as quick as possible.
We do have a few questions that have been coming into the chat. The first one is, maybe Richard, this is your area. Someone's curious if a customer can require the business's employees to be vaccinated before they enter their facility. So for example, if you're a pest control company and you're sending your folks into a nursing home or a restaurant or something like that, could that facility require that before that pest control person comes in, that they have to have the vaccination anyway? Do you know at this point?
I mean, I don't think that we're at a stage. Well, let's put it this way. I think that the way that they're going to require, the pest control guy to get vaccinated before they come in is to say, if you don't get vaccinated, we're going to use somebody else. But they cannot. That's they're more of a market power than a legal power. I don't see a world where anyone can require somebody else to get the vaccine, but they can make their own decision with respect to who they're going to patronize and how they're going to use things. And I think that you're seeing that already. I know that, if you are going to a store and they don't have any, they're not taking any COVID-related precautions, I'm sure many people get to the door, look inside and see that's not going on and turn around. And that's really the power that you're going to have. Again, unless the CDC or the EEOC tells us that there's a vaccine mandate, I don't believe that you can require someone to do it. But there's a difference between requiring and not patronizing. So my advice would be, tell them that, or if that situation came up and said, we would prefer people that can certify they've been vaccinated to come into our facility, that's fine. But if it's just if you're doing it if they're coming in by your agreement, then they can also come in because you don't agree with how they're handling the vaccine.
Thank you. And then this may be both Martha and Richard in your areas. Are vaccination policies something that should begin to fold into company duty of care policies? I don't know if you guys have thought about that at all.
I'm sorry, Martha. Do you want to start?
No, go right ahead. Go right ahead.
I was going to say that I think that the notion is right, that a fiduciary duty of care to the company and your employees. I mean, the duty of care implies that you're going to do things in the best interest of the company. I think the notion is correct, but I don't think that you're ever going to see a requirement that, under our duty of care, you have to do things. But I will say that this sort of stuff kind of falls under the same rules as, and I know this is a weird kind of comparison, but cybersecurity. I do a lot of cybersecurity work, and I advise companies that, if you don't properly handle cybersecurity issues, someone could look at that as a violation of the duty of care to the company. I think that sort of notion that we have here. If you're not properly handling your COVID and your COVID response, it is possible that someone will focus on that as a injury to the company, and that you've not, the fiduciaries of the company have not properly discharged their duty of care. So I don't think that you're going to find that you have to have a written policy and that leads to, discharging your duty of care. I think that you need to have a program in place, and the way that you address this, the pandemic, is something that shareholders and your other stakeholders are going to view and then determine how they're going to react to the company. I believe that I don't know this for sure, but I'm sure that there are certain there are probably lawsuits out there right now where someone said, because your company did not properly handle the pandemic, it injured the company, and therefore the shareholder was injured. Just because that's the nature of these things in litigation generally. If you find something and you can find someone that's going to make that argument, again, if those cases have been out there, they're very early in what's going on. But I suspect that it comes down to, can you show that you considered these issues? Can you show that you came up with a plan, and can you show that you followed the plan that you have in place?
I would agree. I think it's focused much more on the program, much more on the education that we're providing to employees. I think too, on our website, and I've seen it in other small businesses, when you walk into a small business, what we're doing about COVID-19, it's a banner across the top of a website of any size business. Here's how we're addressing COVID-19. So those types of things are important to keep in front of your customers and in front of your employees, that these are the actions that we are taking to protect our customers and our employees.
Yeah, it's as important in this case, not only to be a good employer, but to be a good neighbor, and to make sure that we're all looking out for one another. For some people, how they do that may be different, but I think the underlying ethos of, be a good neighbor, and try to take advantage, try to make sure that you're not doing anything to harm somebody else, are the same principles that you're going to see when we're evaluating companies and how they handle the pandemic.
Thank you. And we've touched on this just a little bit, and I was assuming we were going to get another question. So this person said, I work with a lot of arts organizations who are hoping to resume in-person events and gatherings this spring and summer. How realistic is it that they'll be able to do that? Any perspectives on that?
I think, like many things in this pandemic, we're all just making our best guess. But I think the reality is spring, it just sounds way too soon. I'd like to think that by summer, especially if we are thinking about doing things outdoors where there can be spacing, where we're not, we're sort of thinking about those things we already know as best practices, right? That there would be the opportunity for more types of gatherings, but they're going to have to be smart gatherings, and I think we're going to be seeing that for the longer term. So, like many things in the pandemic, the more creative businesses, and we've all seen them. There's some real folks that have really figured out how to adapt their business models to support their customers in a way that feels safe for everybody and seems to ride the ups and downs. And I think the same is going to be true for the next few months. And boy, I'm really looking forward to the summer, because I think if we do have businesses that think creatively and give us opportunities, especially to be outside and be spread out, but still engage and do a little shopping, which would be lovely. I think, right. I want a nice, find a way. We need a nice outdoor market. I mean, there's just a lot of different kinds of ways I think we'll be able to feel a little bit safer, but it's not going to go away. Does that make sense?
Yeah, I kind of think that, this is not a perspective, this is just a perspective. But I think that we're going to go the way of, some other countries like Japan and other places that just for flu season typically wear masks in larger gatherings and on airplanes. And I think that you're going to see some people that are going to err on that side of caution, even when everything is fine. And you might see, I like going to live music concerts, and you might see even a year from now, people at the Beachland Ballroom wearing masks while they're watching, their favorite act, and there's nothing wrong with that. People need to, to do what they think to be safe. And I think that, we're just going to start adapting to these things.
And within that,
you really do miss, going to a concert or being able to, go to an art exhibit but to the points that have been made, I think that particularly in Cleveland, our arts community is just so resilient and has such support from the community. And certainly I hope, and I know that that'll continue as we hopefully get to a point during the summer and beyond where we can start gathering again for arts events.
Yeah, hopefully we'll see a resurgence of like theater in the park.
Yeah.
You got it. I don't see any reason why we shouldn't. And I also, just to tack on to Richard's very good points about what's going to change for the long term. The one I'm really hopeful about and interested in, and I think most folks know this, but we have not had any flu this year, right? No flu. If you want to see the Australian data, they went from literally hundreds of deaths to no deaths. And we're seeing the same thing here in the US, the same thing here in Ohio. Found a cure for the flu. And it turns out that it's staying home if you're sick, washing your hands, masks, and social distancing. And so if I think, there's one other thing I wish we'll take away from this, is the idea that it's somehow okay to be out and about and come to work when you're sick. And I think there's got to be a space for employers to say, especially since we've figured out the technology, to say, you know what, if you're feeling well enough to work, but you're all, you've got the crud, stay home, call in, keep it to yourself. And I hope that's a permanent change, because there's a difference. I really think that we've realized there's a difference between saying I'm too sick to work and I'm going to stay home, and that I just don't feel good and I got something, but I'm good enough to work. And I think it's that category that I'd really like to say we can use other things, come back in when you're feeling better, because then the rest of us don't end up getting it, and that's what we see. So I think hopefully that'll be at least a positive that we take from this.
Yeah, I think that's right. I mean, I used to have the rule that if I didn't have a temperature, it meant that I could go in. And I think that lots of people probably did the same thing, but that's not right. And especially in this stage of where we are, that's not the right mindset. And especially as employers are providing their employees accommodations to work from home. If you're lucky enough to have a job that allows you to work remotely and do those things, employees should be taking advantage of those things so that they're not spreading the virus. One thing that I don't know if it's been in the chat or a question, but one of the questions I have for Dr. Watts or Martha is, when do you think that we'll be able to shake hands and hug again? There are a lot of business people out there that are very flustered when they have meetings trying to figure out what to do.
Yeah.
I get Martha's a better answer, but I'll give my 2 cents. I hope shaking hands never comes back. Something else. I don't know if it's bowing. I don't know if it's the elbow, but I think maybe shaking hands is not so good. Hugging, I think I'll stay away from. If you want to hug, and who you're hugging is your own business. I wonder if
no comment. I think the handshake is going to be a long time in coming back. I think you're going to see the fist pump or the elbow or what have you. But I think just to be able to be in a conference room with more than 3 people will be certainly a milestone. I also think that it's important as business owners and as employers to recognize how very difficult this past year has been for everybody, with people having their kids, virtual or in a hybrid environment from a school standpoint, from, trying to set up a home office, or making sure that if they are working in a plant or in a store or in an office, that they're, taking advantage of all of the masking and social distancing and washing their hands. I mean, there's been a lot of pressure, a lot of mental health concerns. And I think as employers, it's important to keep that in mind as you're dealing and relating to your employees, that people are under a lot of stress, and providing good information and education on the vaccine and on what you're doing to keep employees safe is going to be important for a long time.
Thank you. And we are just getting to the end of our hour. So thank you all for participating. This was a lot. This was great. We're getting a lot of really good comments in the Q&A that people have really benefited from hearing this information from you. I did receive a few comments from folks who were interested in some of the things that Martha shared, just how you're educating your employees, some of those resources. We will make sure we get those out to everyone that attended. We'll send those out to you via some links as well, because I think that was very helpful information. Martha, thank you for sharing that. And thank all of you. If you have any closing comments, I'll open it up for a minute if you have anything that you want to say to close. And otherwise, we will just end the webinar and make sure, as I noted, to send this to other colleagues that you have if you think it would be beneficial for them to hear as well.
The only thing that I want to end with is I kind of think, is the same sort of ethos that applies to if you're not feeling well, you should stay home. And if as an employer you have questions about how you're handling this, you should talk to someone either through the EOC has a question and answer line. I won't speak for the CDC, but I know the EOC has specific, you can ask them questions. If you have a relationship with a law firm or your lawyer, ask them questions, but don't guess at this. This is not something that people should not be taking seriously. They should be taking these things seriously, both on a health and a legal perspective.
Thank you. Dr. Watts, Martha, you're good?
I would absolutely 100% agree with that. It's important to, remember that we're not going to get away from some of the social distancing and masking and washing your hands, that it's always good to check with someone or check all of the available resources when you're thinking about, how you're going to treat the vaccination within your workplace, but really within the boundary of, let's, as employers and as businesses, make sure that we're being as safe as possible in providing information on how we're keeping our workforce and our places of employment safe.
Yeah, and employees should also feel like they can ask their employers questions about these things. I think that is something that people sometimes miss.
And I think frequently asked questions are a great opportunity to post somewhere, and certainly there are organizations like the CDC and others that provide a lot of good information. So
great. Thank you all, and thank you all for joining us for today's webinar. We will hopefully see you on our next webinar, which is actually taking place next week. We are doing a webinar on PPP2. And the SBA is going to be presenting all the information that you as small business owners need to know in order to access that resource as well. So thank you for joining us and have a great rest of the day.
Thanks so much, Megan. Bye-bye now.
Bye-bye.